What you do not want to see is any pus or any odor coming out of your baby's cord stump. You also do not want to see bright red blood or any kind of oozing coming out of that stump, because that can be a reopening in a blood vessel, and that needs to be addressed immediately. That's not normal. Get your baby to get seen. Hello moms and dads, and welcome back to Nurse Onye Teaches. My name is Onyinye, and today I will be covering 8 things that moms and dads need to keep aware of as they take care of their newborn. But before I jump into today's video, make sure you hit the subscribe button and don't forget to turn on your notification bell so that you are made aware of every time I upload a video. Now, as parents begin to take care of their newborn, they may notice some slights here and there. But if you notice any of these 8 items, you need to take action very quickly. And the first one is how your baby is breathing. A lot of babies breathe very quickly when they are first born, and that's okay. But if you catch your baby gasping for air or breathing too quickly, or he or she stops breathing completely and starts to turn blue, you need to get to an emergency center as quickly as possible. That is not normal. Now, as you are taking care of your baby, it's very important to keep aware of something known as jaundice. Jaundice is when the white in your baby's eye, or his or her skin and mucous membranes, such as the space in their nose and underneath their tongue, begin to turn yellow. Yellowing of these sites on your baby is not a normal thing and needs to be addressed accordingly. If jaundice is left untreated, it can result in some very nasty outcomes for your baby. It can trouble their brain, and it can definitely affect other organs in their body. So get them treated as soon as possible. Some babies may need phototherapy. Some other babies, the doctor may just advise you to expose the baby to sunlight, increase how much your baby is eating so that he or she can begin to have bowel movements and urinate, as this is the most effective way to clear jaundice out of the body. Now, the third thing on this list is known as your baby's fontanelle. The fontanelle is the very top part of your baby's head, also known as him or her soft spot. This soft spot tends to pulsate every time your baby's heart beats, and it should normally keep very flat or even with your baby's head. Now, if he or she is crying, the fontanelle may lift up just a little bit and appear to bulge, but that's okay. It's if your baby is not crying, or he or she is completely still, and this fontanelle is still bulging or is higher than the level of their head, that you need to be concerned. Also, if your baby's fontanelle sinks in, then you need to either get your baby hydrated, or if you are sure that he or she is well hydrated, get that baby seen by their pediatrician or a doctor immediately. The next thing that parents need to keep aware of is their baby's temperature. Newborn temperature can range anywhere from 97.5 degrees all the way up to 99 degrees. If your baby's temperature goes below this or goes higher than this, then your baby can face adverse outcomes. Make sure that you don't have baby underdressed or overdressed, as newborns tend to gain heat or lose it very quickly. They're very small and compact, so keep an eye out for that. If your baby's temperature gets any higher than 100.4 degrees, take that baby into the hospital to get seen. If your baby's temperature continues to rise and does not get checked, it can cause some serious damage, such as brain damage. It can cause organ damage, and these are things that you do not want to deal with in your baby. Another thing that parents need to keep aware of is how active or not active their baby is. Most babies, even when they're sleeping, will move around a little bit, or when they are alert, they will turn to you, cool, move their hands, flex it up, flex it down. If your baby is rigid and locked in position, that is not normal. Get your baby to be seen by the doctor immediately. If your baby is completely loose and lethargic, meaning that he or she is just extra tired and moves just a little bit when you touch him or her, or does not move at all, get your baby to be seen by a healthcare provider immediately. That lack of energy in your child can be due to many different things in the body, and you want them to get to the root cause of it so that they can help you help your baby. The next thing that parents need to keep aware of is how well their baby's umbilical cord is drying out and getting ready to fall off. It's normal for your baby's cord stump to stay attached for upwards of 10 days to 2 weeks after your baby is born. What you do not want to see is any pus or any odor coming out of your baby's cord stump. You also do not want to see bright red blood or any kind of oozing coming out of that stump, because that can be a reopening in a blood vessel, and that needs to be addressed immediately. That's not normal. Get your baby to get seen. Parents need to keep aware of how well their baby is eating and how effectively your baby is digesting his or her food. Now, it is normal for newborns to spit up a little bit after they have just had a meal. What you do not want to see is something known as projectile vomiting, where your baby shoots their milk across the room or shoots it any appreciable distance. That forceful throwing up, it can be a sign that something is not right in your baby's digestive tract, and that needs to be checked out immediately. The next thing parents need to be aware of is constipation or diarrhea in their newborn. It's normal for babies to have loose bowels, but it should not be flowing out of them like pure liquid. It's also not normal for a baby to be constipated, because think about it, your baby is on a liquid diet. If your baby is constipated or straining, he or she may need to be evaluated by his or her pediatrician or a doctor who specializes in caring for babies, because there may be some kind of obstruction somewhere, or your baby may be eating the wrong type of formula, or may be allergic or have some sort of nasty response to what they are being fed. Make sure you get that child taken to the doctor so that any of these concerns can be addressed. Now, these are generally not frequently seen, but it's good for parents to know these things so that if they see it, they can respond quickly. Now, if you have learned anything in the content of this video, make sure you subscribe, give me a thumbs up, turn on your notification bell so that you are made aware of every time I upload a video. Don't fail also to share it with somebody who you believe may benefit from it. Come along with me as we build this community of learners. And until the next time, you all be blessed.